Okay, so let me repeat all these things what we studied so far. We are going to summarize all these things. Okay, all this slide we have made before, so we are going to go through it and learn about all these things. Okay, so what is conjunctivitis? Conjunctivitis is actually the inflammation of conjunctiva that causes this disease causes the pink eye. So that is why common people call this disease by the pink eyes name. Okay, so conjunctivitis is also known as pink eyes. Now what is conjunctiva? Conjunctivitis is the inflammation of conjunctiva. But what is conjunctiva? Conjunctiva is actually the lining of the white portion in your eyes and the lining of the inner eyelid. Okay, I have written it down in the definition. Okay, is defined as the inflammation of the mucous membrane that lines the inner eyelids और द स्क्लेरा ऑफ द आई. उर्दू में बताता हूँ आपको कि ये वो लाइनिंग होती है जो कि आपके इस वाइट पोर्शन के ऊपर लगी होती है और आपके जो इनर जो आईलिड है इसका जो इनर पोर्शन होता है, ठीक है, जिस तरह आपको ये नजर आ रहा है, ठीक है, जिस तरह आपको ये नजर आ रहा है, ये जो जगह होती है इसको कवर करने वाली लाइनिंग को हम कंजक्टिवा बोलते हैं और उस कंजक्टिवा की इन्फ्लेमेशन को फिर हम कंजक्टिवाइटिस बोलेंगे. ओके, अंडरस्टैंड? Then there is the causes of conjunctivitis. How do you get conjunctivitis? आपको conjunctivitis क्यों होता है? Okay, conjunctivitis can be caused by viruses. Okay, there are many viruses and it can cause conjunctivitis. Conjunctivitis can also be caused by bacteria and a number of bacteria, but the most common bacteria are Streptococcus pneumonia, Staphylococcus aureus, and Haemophilus influenza. So these are the most common bacteria that are involved in the conjunctivitis of bacteria, right? And conjunctivitis can also be the result of allergic reaction. Your body can be allergic to dust, it can have allergic response to smoke or pollens, anything like that, and that can cause allergic conjunctivitis. Okay, so basically there are three types of conjunctivitis. Next is, what are the clinical sign symptoms that you see in the patients? Clinical sign symptoms are the things that tell you about the cause of the disease, okay, that tell you about the condition of the patient. So whenever there is a patient of conjunctivitis, he will have these sign symptoms. He will have redness in the eyes, he will have pain in the eyes, he will have itching in the eyes, he will say that I have something there and it's itching and I have to scratch it. Okay, so there will be itching in the eyes and there will be foreign body sensation. Now what is foreign body sensation? Foreign body sensation is the thing when patient tell you that there is something solid in my eyes but I cannot pull it out, so please look into my eyes and tell me what is it. So when he feels there is something in the eyes, this is known as foreign body sensation. And after that there is swelling. So swelling is mostly in the allergic conjunctivitis. Why it is in allergic conjunctivitis, I told you about that there is this for example there is this um, okay, there is this artery. Okay, and this, suppose this artery is in your eyes. So whenever there is allergic conjunctivitis, allergy will release histamine in your body, and that histamine causes vasodilation, and because of this vasodilation, pores will open in the vessels, and from that pores fluid will go inside, go outside, and outside they will cause swelling. Okay, so this is the swelling scenario. Okay, after that you will notice that there will be certain kind of discharge means something that's coming out of the eyes. Okay, so discharge can be of many types. It can be purulent discharge, which is pure white color, pus color discharge. There can be watery discharge. It means that the discharge is only watery, and there is tearing in the eyes and water is coming down. Okay, and there can be mucopurulent discharge. Mucopurulent discharge is when the discharge is a mixture of mucus and pus. Okay, so this is known as mucopurulent. So mucopurulent discharge and purulent discharge both are found in bacterial conjunctivitis, but most commonly the bacterial infection shows purulent discharge. Okay, and viral and allergic conjunctivitis shows um, watery discharge. Okay, so this is the discharge. And how do you make diagnosis? You make diagnosis by doing clinical examination. Clinical examination is the procedure when you okay, there's is when you make the patient sit in front of you and you check his eyes, and those eyes shows you signs and symptoms. It shows you discharge, it shows you swelling, it shows you pain and itching and redness and everything. So this is the clinical examination. You get to know about the patient by doing clinical examination. You can also take help by doing laboratory tests like culture of the swab. You can also do the PCR testing of these swabs. They can tell you about the organism. And you can also do the crust analysis. Okay, crust analysis. Okay, discharge analysis. You can take the discharge and you can look into it and you can decide what kind of conjunctivitis it is. And you can take help by CBC, doing CBC. Now what is CBC? CBC is actually a blood test that tells you about different meters of the of the things in your blood. It can tell you about the white blood cells, which kind of white blood cells is raised here. Just a tip for you that in bacterial inflammation, you see rise in neutrophils, and in most of the cases, in most of the viral cases, you see lymphocytes rising. Okay, so CBC can just help you about making diagnosis. And once you make this diagnosis with the help of these things, you will treat the patient. And how do you treat the patient? Treatment is usually depending upon the cause of the disease. First, you have to know about the cause of the disease, then you have to treat the patient. Suppose if there is viral conjunctivitis, so there is no specific treatment. You do not have to give any specific antibiotic. You just have to give supportive treatment. You have to tell the patient to take the hygiene, do the hygiene and of the eyelids. You can tell him that um, take artificial tears and take care of the eyes, and it will go on its own. So usually depend upon the cause of the disease. Okay, in bacterial conjunctivitis, you have to give the antibiotic can be of low dose, and it can be broad spectrum antibiotics. Okay, so broad spectrum antibiotic like ceftriaxone can be used when there is a chronic disease like gonorrheal infection, like chlamydial infection, and or the we can say that the macrolides and azithromycin and erythromycin can be used in case of um, in case of no chronic disease. Okay, artificial tearing can be used. Artificial tearing means artificial tears, drops of tears, and that can help the eyes to be clean, and that can help the eyes to be clean, and it can help the eyes to be moist and um, you know wet. Okay, and steroids can be used. Topical steroids can be used. Now what is topical steroids? Topical steroids are the tubes of the steroids that you use to decrease the inflammation. Okay, you can put it on the on the eyes, and it can reduce the inflammation. Okay, topical antibiotics can be also used. Topical antibiotics, like I said, in case of bacterial conjunctivitis, erythromycin, clarithromycin, and antibiotics like this can be used. Okay, and oral antibiotics or IV antibiotics are only used in case of chronic diseases. Okay, this is the treatment. And then after that you have to learn about the complication are the things which you do not usually see but can happen. It can cause permanent blindness if not treated, if the disease is not treated. If not treated, it can cause permanent blindness. And it can also lead to a number of other eye diseases like keratitis, dacrocystitis, blepharitis, and etc. like that. Okay, so this was today's topic. I hope it was informative, and I hope I covered all the things. So if I'm doing it in English, bear with me, please. I'm practicing I myself also, and it's also for the for the audience that are not in Pakistan. Okay, so conjunctivitis, pink eyes, and after that you learned about okay. You learned about definition, causes, clinical signs, symptoms, discharge types, diagnosis, treatment, and complication. Okay, so thank you very much for listening. I hope it was informative. See you in another lecture. Goodbye.